Good evening, and thank you for joining. We've experienced firsthand how the COVID-19 situation can and has changed rapidly. On January 28th, 2021, we received the first positive result of an individual who lives in the Skyline Lancelot apartments. The individual's exposure was related to international travel, and their sample was sent for COVID-19 variant of concern, or VOC testing, which we received a preliminary positive result on the evening of February 2nd, 2021. After additional investigation, public health was made aware of the VOC on February 4th, 2021. All members of the person's household have tested positive for COVID-19. On February 4th, 2021, we received confirmation that another individual who lives in the same building tested positive for COVID-19. After case management and contact tracing, the individual did not have a connection to the other building residents who tested positive for COVID-19. Due to the overall low number of COVID-19 cases in our community and how rapidly the COVID-19 variant of concern can spread, the Health Unit's Communicable Disease Control Team flagged this occurrence on February 5th, 2021. The Health Unit worked with the North Bay Regional Health Center's assessment team to coordinate an on-site COVID-19 testing. February 6th, 2021, the Health Unit was informed of an additional resident of the Skyline Lancelot apartments who tested positive for COVID-19. That same day, a Health Unit staff member wearing full protective equipment went door to door to inform the residents of the situation, asked them to self-isolate, and advised them of the on-site COVID-19 testing that would take place the next day. February 7th, 2021, North Bay Regional Health Center's Assessment Center tested roughly 110 people from the apartment building on site. Yesterday, February 8th, 2021, the Health Unit declared an outbreak at the Skyline Lancelot apartments as 17 residents had tested positive for COVID-19. As test results can take days to come back, we are still awaiting results from a number of individuals who were tested at this location. Later yesterday, the Health Unit was made aware of a member of the Sunset Park Public School community who tested positive for COVID-19. The Health Unit contacted all parents of children in the same cohort and all parents whose children take the same bus to inform them of their high-risk exposure and the need to self-isolate for the next 14 days. This morning, the Health Unit confirmed a connection between the individual from the school community who tested positive and the COVID-19 community outbreak at the Skyline Lancelot apartments. Due to how easily COVID-19 variants of concern can spread, I made the decision to close the school. This was done out of an abundance of caution, as we have the opportunity to stop the spread of COVID-19 variant of concern before it's too late. As of today, 19 people who live in the apartment building have tested positive for COVID-19. All samples from the individuals who have tested positive for COVID-19 have gone for the variant of concern testing. So at this time, 3 individuals have tested positive for the variant of concern. We're still awaiting the results from the others. Due to this situation at hand, over the weekend, I reached out to the provincial government to keep our district in shutdown. The province has seen the devastating effects of COVID-19 variants of concern, and we need to act now to stop the spread locally. With the extension of the stay-at-home order and the increased risk of transmission of the COVID-19 variant of concern, outdoor public skating rinks, skating trails, and tobogganing hills will remain closed. As a result of the threat of COVID-19 variant of concern and the unessential travel between Health Unit districts, OFSC trails and snowmobile trails on Crown land will also remain closed. I will continue to monitor the local situation and reevaluate the closures on February 16th. We are at a crossroads. We can work together as a community to stop the spread of the variant, which will help keep our hospitals from being overrun and prevent the spread into our long-term care homes. We just received the first dose of a COVID-19 vaccine. Or we can choose to put the lives of our family, friends, and loved ones at risk. Now more than ever is the time we need to step up and put the health and safety of our community above ourselves. So now I'm going to answer questions from the media. PJ Wilson Nugget. What is my opinion on the provincial announcement and extension of the shutdown? As stated, I am in favor of the shutdown and advocated for it. The COVID-19 situation locally is changing quickly, and we need to get a handle on the situation. However, we cannot do this without the help of the public. We need people to stay at home and follow the order. What is the situation on snowmobile trail closures and local restrictions in place? Our focus really needs to be staying at home, only going out for essential reasons, and stopping the spread of the COVID-19 variant of concern. There are 19 people whose only connection is living in the same building who have all tested positive for COVID-19, and we have received preliminary positive COVID-19 variants of concern for 3 individuals. The OFSC snowmobile trails on Crown land, skating rinks, skating trails, and tobogganing hills will remain closed until February 16th, at which time I will reevaluate the situation. Francis Baudry, Radio Canada. I was wondering if you're able to give me numbers on vaccination and complete immunizations of long-term care employees in your health unit. By the end of today, we will have completed the ministry's mandate for immunizing all long-term care home residents and First Nations elder care individuals and staff within our district a day ahead of schedule. To date, 972 long-term care home residents have been immunized. 18 alternative level of care patients awaiting transfer to long-term care homes, 42 healthcare workers in long-term care homes, 20 First Nations elder care facilities, 24 First Nation healthcare providers, for a total of 1,076. Could we have an update on the situation surrounding variant of concern cases? I've already addressed this, however, I think it's important to reinforce the fact that we need to act now. We have had 19 people test positive for COVID-19 in the building, and 3 individuals have preliminary results indicating a COVID-19 variant of concern. Angela Gemmel, CBC Sudbury. When was the issue noticed? When will results be in? And is there an investigation taking place? As discussed earlier, all residents of the building were notified of the situation on Saturday, February 6, 2021. COVID-19 testing took place on Sunday, February 7th, and results can take up to 10 days to receive. However, we have experienced quicker turnaround times. Anytime someone tests positive for COVID-19, there is an investigation that takes place to determine where they may have contacted the virus and any close contacts they may have had. The health unit also conducts surveillance to look for any connections, such as locations of residence, as with this situation. We will continue to do this work to help track the spread and help to stop it with preventive measures, such as closing the Sunset Park Public School. Jennifer Hamilton McCharles, The Nugget. Why are we a part of extension? As I stated, I am in favor of the shutdown and advocated for it. We need to get a handle on the local COVID-19 situation before we reopen. If we don't, people's lives will be at risk. How long do you plan on extending the local closure, considering the district will be moving into a colored zone on Tuesday at 12:01 a.m.? I will continue to review the local situation and make appropriate decisions closer to February 16th. Why aren't residents at the Lancelot being told to self-quarantine? All individuals who have tested positive for COVID-19 and all high-risk contacts are required to self-isolate. Other individuals who live at the Skyline Lancelot apartments have been asked to self-isolate. Due to the laws, unless someone tests positive for COVID-19 or is at high-risk contact or symptomatic, we cannot force people to self-isolate. Declaring an outbreak does not make everyone high risk. Why are there so many false positive tests? Based on PHO laboratory data, we are aware that the incidence of false positive tests that are later corrected is extremely low. The exact incidence for the province is not known, as individual reports that are corrected do not require notification. As of May 23rd, 2020, PHO laboratory has detected false positive COVID-19 results on approximately 20 occasions among over 228,000 specimens tested to date for COVID-19, with approximately 11,000 specimens testing positive. This represents a false positive rate of less than 0.01%, which is well beyond performance targets for a laboratory test, even acknowledging that there may be some false positive tests that are not detected. When is our next shipment of vaccines slated to arrive, and who will be given them? At this time, we don't know. There is limited supply throughout Canada and Ontario. Are the folks at the Lancelot all hit with the original version of the coronavirus, or is there a mix of the original and variants? If it is a mix, which variants are present? All individuals who have tested positive for COVID-19 have had their samples sent for COVID-19 variant of concern testing. And at this time, we have only received 3 back, and all 3 have had the preliminary positive for COVID-19 variant of concern. How many variant cases are there in the regions? So far, there are 3 variant cases confirmed within the region, all connected to the apartment building outbreak. Currently, we are awaiting the test results that confirm which type of COVID-19 variant of concern we're dealing with. How many residents or units are there in the Lancelot building? There are approximately 90 units and 130 residents, and we can confirm that roughly 110 people were tested for COVID-19. Kelly Grant, Globe and Mail. The release says that as of today, 13 people tested positive from the building. Then in the next paragraph, it says that 17 have tested positive, which is correct. As of 3 p.m. today, there now have been 19 residents and 2 visitors testing positive for COVID-19 in relation to the community outbreak. Are you able to say how many of the 110 have tested negative? Well, until we receive all the test results, we are not able to say how many residents tested negative for COVID-19. Residents who have tested negative should still monitor for symptoms and should self-isolate and get tested if COVID-19 symptoms were to present themselves. Have the other positive cases not screened preliminarily positive for variants of concern, or are you still awaiting for screening results on all of the other positive, except the 2 that screened positive for variants? There are currently 3 individuals that have received preliminary positive results for COVID-19 variant of concern. At this time, it is unknown to the health unit if any more cases will be positive for a COVID-19 variant, but is highly likely. Specimens of individuals who have tested positive for COVID-19 have been sent for further variant testing. Are you able to say anything about the relationships between the people who tested positive? Do any live together or have any other contact? There has been spread among individuals living within the same apartment, as well as between apartments. The health unit continues to perform case management to further investigate potential links. Joey Russi, Your TV, North Bay. Will outdoor gatherings of up to 10 people with 2-meter distancing be allowed as of February 16th? So until we receive more details from the province as to when the stay-at-home order will be lifted for our district and our return to the provincial color-coded response framework, we must continue to follow stay-at-home orders. Trips outside of your home should be limited to essential trips only, such as going to school, work, groceries, and medical appointments. On February 16th, the province will determine if we remain in the current shutdown or if we will move to the provincial color-coded response framework. Martha Dillman, CBC. About 110 people in the apartment were tested. Is this all the residents who live in the building? No, this is not all the residents of the building. There are approximately 130 residents. Testing was made available to all residents on Sunday as the North Bay Assessment Center offered on-site testing. We're still awaiting results for some residents. However, we encourage any resident who do not have a chance to get tested to book an appointment at the COVID-19 Assessment Center. Are all of the test results back yet? No, we're still waiting for the test results. When are you expecting more details on the variant information? Specimens have been submitted for further testing to Public Health Ontario. However, we do not have a specific timeline for testing. We will notify the public once the test results are available. Does the health unit have any idea how this spread in the building? Previous release stated the only connection is that these people live in the same building. There is still a lot we don't know about the COVID-19 variant of concerns, including how it spreads. We are still awaiting confirmation of the strain of the variant. We do know that it spreads very easily. Regardless of the strain, residents of the building should be following public health directions and have been provided to them. Wash their hands with soap and water or sanitize often. Practice social distancing in common areas such as lobby, elevator. Wear face coverings when physical distancing is a challenge, indoor or outdoor. Not visit friends, family, or neighbors. Avoid touching their eyes, nose, or mouth. Self-isolate if they're sick and avoid contact with a person who is sick. Cough and sneeze into their elbow, sleeve, or tissue. And stay at home except for essential reasons. Eric White, CBC Radio. Have any protocols for the apartment building been put in place? Yes, the Health Unit has provided recommendations for enhanced cleaning protocols and frequent cleaning schedule. We asked that the building does not have non-essential visitors and that residents self-isolate. Clark Heipel, Cogeco News. Why did the Health Unit wait until Monday to announce which apartment is in question regarding outbreak? Well, the Health Unit didn't wait. Once we started to receive the results of the COVID-19 test, we called an outbreak, informing the residents of the building and the public the same day. Over the weekend, we didn't have enough information to determine if an outbreak would be declared. What is the outdoor gathering limit and will that change in the near future? Our Health Unit district is still under provincial shutdown, which means you should not gather with individuals who are not members of your household. And if you live alone, you may consider having close contact with one other household. Until our region enters back into the color-coded response framework, you may gather with up to 4 other people outdoors, as long as you can keep 2 meters physical distance from people you do not live with. You should also wear a mask or face covering. Until we receive more details from the province as to when the stay-at-home order will be lifted for our district and our return to the provincial framework, we must continue to follow protocol for the stay-at-home order. Was Sunset School closure considered to prevent spread following students' positive tests? Today, the Health Unit has dismissed all students and staff of the Sunset Park School. These measures were out of an abundance of caution to reduce the spread of the virus, as this dismissal is related to the COVID-19 variant of concern. Our number one priority is to protect the health of all the students, staff, and school community. So at this time, the Health Unit has not declared an outbreak in the school. Individuals who attended Sunset Park Public School should follow public safety measures communicated to them by the school and should self-monitor for any COVID-19 symptoms. Chris Dawson, Bay Today. Is there a concern at the North Bay Mall due to the proximity of Skyline? Everyone should assume COVID-19 is present everywhere in our district. Every time someone leaves their home, other than for essential trips, like going to school, work, groceries, or medical appointment, they're putting themselves and others at risk. This is even more important with the confirmed presence of COVID-19 variant in our district. Residents of the Skyline Lansdowne apartment, or anyone for that matter, should not go out if they have symptoms. Individuals who have symptoms or have been in contact with a confirmed case of COVID-19 should self-isolate and arrange to be tested. Has the Skyline Property Management Company complied with your protocol? Is there a concern for management and staff going back and forth to other apartments they run? The staff of the Skyline have been working with the public health to help ensure protocols are met to protect residents and staff alike. That information has been shared with residents of the building in a timely manner. Will you remove outdoor restrictions at outdoor rinks, toboggan hills, and snowmobile trails as well on February 16th? If not, why? Although the plan is for the stay-at-home order to end on February 16th, we will review the situation at that time to determine if it is safe to gradually reopen. Due to the threat of the COVID-19 variant and the unessential travel between Health Unit districts, OFSC trails and snowmobile trails on Crown land will remain closed until then. Eric Thompson, West Nipissing Tribune. Do you have any insight as to how the virus was able to spread through Skyline Lancelot Apartments? No, this is currently under investigation. Will residents that have tested negative for the virus be discouraged from returning to the building? No, they live in the building. This is their home. We have requested people to self-isolate, and if someone has received a negative test result, to continue to self-monitor for symptoms. If they develop symptoms, they should self-isolate and arrange to be tested. With COVID cases climbing in the area and a return to color-coded response framework set for next week, what color zone will North Bay, Parry Sound be in on February 16th? Well, at this time, it really is too early to know. We need to see how the situation unfolds over the next week. Brad Oben, Moose FM. How long are you extending the local closures? Will they be reopening next Tuesday? Well, the government extended the shutdown for 1 week until February 16th with the stay-at-home order, and local restrictions are still in effect for our health unit district. At that time, the situation will be reviewed to determine if it is safe to gradually reopen. As the health unit found this particular variant strain, specimens are still being tested for COVID-19 variants of concern, which could take a few days. Currently, 3 preliminary test results have come back positive for the variant of concern and are currently undergoing more testing to determine the strain. It's too soon to know which variant we're dealing with. In what scenario will you be able to give the communities under your jurisdiction the thumbs up to enjoy traditional winter activities again? At this time, our focus should be on stopping the spread of COVID-19, especially the variant. We must all follow public health measures to keep one another safe, save lives, and prevent our healthcare system from being overrun. We are facing a very difficult situation and are seeing COVID-19 variants spreading through the community. We must act now to stop the spread. Under the province's new color-coded framework, what level will we be entering on Tuesday? We do not know what level the framework will be entering in, or if we'll be moving to the framework on February 16th. This will all depend on on many factors. Right now, we need to focus on the following the stay-at-home order. Mayor Carol Ballantyne, how long are these extended restrictions in place for? Extended restrictions will be in place until Tuesday, February 16th, at which time the province will determine if we remain in the current shutdown or if we will move to the provincial framework. So this time I wish to summarize. At my request and urging, the government extended the shutdown for 1 week until February 16 with the stay-at-home order and local restrictions in effect for our health unit district. At that time, the situation will be reviewed to determine if it is safe to gradually reopen. My decision to remain in shutdown was a difficult one. I understand how tired, fed up, and frustrated everyone is. How this pandemic has impacted everyone's physical, mental, and social and economic well-being. The shutdown is not being extended out of an abundance of caution, but because of the serious threat we're now facing. We have community spread of the variant of concern, and it is spreading quickly. Until last Friday, our district had relatively few cases. Because of that, we have an opportunity to contain the variant. In order to do that, we must all act now. We must all follow public health measures to keep one another safe, save lives, and prevent our healthcare system from being overrun. The people on the front lines responding to emergencies, caring for the sick and elderly, are working to keep everyone safe while putting their own lives at risk every day. They cannot do it alone. They need your help. We all share this responsibility. That is why we're pleading with you more than ever before. Please stay at home. Only go out for essential reasons. Physically distance, wear a face covering, and wash and sanitize your hands often. Until a vaccine is readily available and the majority of the population is immunized, which will likely not be until the fall, these are really the only tools we have to fight this virus, slow the spread and save lives. So thank you for attending and stay safe.